Welcome back to Tuesday Tips. You know, our Jeopardy game got quite a bit of um, people liked it. We got some great comments, with our newsletter this past week. So we thought we'd go a little deeper into some of the other categories. But I'm going to try and make this a little bit more realistic. So let's get ready. Let's play Jeopardy. And we're going to be, again, the theme is your nurse advocate consulting, helping you understand that things that you may not know, we know, and we can help you read between the lines, know what should be there, what shouldn't be there. So let's go ahead and get started. I'm going to go ahead and share my screen, and we're going to go ahead and get started at playing Jeopardy. So here we go. All right. Okay, so we have the categories. We have what is a nurse advocate? We have getting your affairs in order. We have aging in place. We have finding senior living. And we also have managing healthcare needs for aging adults. So let's go ahead and get started. So let's start with what is a nurse advocate for 100? So this is the answer. So think about how Jeopardy is played. And so you get the answer and you're supposed to come up with a question. So I'm going to give you a little bit, just a second to think about this. And the answer is before a healthcare crisis, before a crisis occurs. And so the answer to this is, when should I reach out to a nurse patient advocate? So again, a lot of what we do, people call us when they're in the middle of a crisis, and it really takes a lot more effort and time on our part to be able to find out, all the history so that we can bring ourselves to the present of what the crisis is and then help you put a plan in place or answer questions. So it's always best to reach out to an advocate before there's a crisis. So let's continue. Let's try getting your affairs in order for 100. All right, so this document names who can make medical decisions if you can't. We've done many videos about this. We've talked about this quite a bit. So again, think about this is a document that names who can make medical decisions if you can't. And the correct answer is, many of you probably got it, healthcare power of attorney advanced directives. So that was an easy one for under that category. So let's go to the next category, aging in place for 100. And I wish we were doing this interactive so that you could select the category and the dollar amount. And so that would be really fun. Maybe that's a webinar we may do in the future, but let's go ahead. We'll move on to aging in place for 100. So the answer is the number one place many older adults fall is here. So think about this is aging in place. We're thinking about safe. How do we keep our aging adults safe at home? So the answer to this question is the number one place many older adults fall is here. So think about what that might be. So I'll go ahead and reveal the correct answer. And that is the bathroom. That is the number one place where if our aging parents are going to fall at home, this is the place where it happens. So therefore, the bathroom is the best place to start with putting safety measures in place, grab bars, maybe raised toilet, lighting, things like that. So let's go ahead and continue. All right, let's go to finding senior living for 100. So the answer to this is, this option is best for someone who is mostly independent but wants community and fewer chores. So think about this. Think about some senior living communities that an aging adult can move to. And this is, again, the clue is this option is best for someone who is mostly independent but wants community and fewer chores. So the correct answer is, what is independent living? They're in a continuum of care. You have independent living, then you have assisted living, then you might have memory care, you might have enhanced assisted living, then nursing home care, hospice, so on and so forth. Those are the different levels of care. So this one would be independent. What is independent living? All right, let's move on. So managing healthcare needs for aging adults for 100. So the correct answer is bringing this to appointments improves accuracy and saves time. So think about What is one thing that your aging loved one or you as accompanying them to their appointment can bring that will help improve accuracy and save time? And hopefully many of you got this right. And the correct answer is, what is an updated medication list? An updated medication list also includes over-the-counter medications. It includes vitamins, supplements, herbs. It includes what another doctor might give, be prescribing. You could have medications from different providers, and we all need to have them in an updated list. So most of the time when you go to your doctor appointment, that's one of the things that when they're checking you in, checking your vitals, is that they're looking to say, okay, they run through your medication list and ask you if there's any changes. So you may forget. So always having, my mother-in-law was very, very good at this. I was very proud of her. She always kept her medication list in her purse. And she would update that, but she always had the current list with her. So let's move on to the next category. So we've done the $100 questions. Let's move on to, what is a nurse advocate for 200? The answer is, my siblings and I cannot get on the same page when caring for our parents. We need something to keep us on track. What could that be? What could, in using an advocate, think about us, and if you know us and know our services, think about something that we could provide or that we could do to provide this for you. So hopefully you've taken a second to think about that. And let's go ahead and let's reveal the correct answer. And the correct answer is, what is our free family caregiver meeting agenda? That is free. If you're seeing the video, reach out in the comments. It's going to be hard with Jeopardy today to list all the different resources we have for all the categories and questions. So if this is something that you feel would help keep you on track with your family and your siblings to keep moving the conversation forward and addressing the needs of your aging parents, please, leave us a comment and ask us for the link for our free family caregiver meeting agenda. All right, let's continue. Let's go to, we talked a lot about getting your affairs in order for the last video. So I'm going to go ahead and skip that just for time's sake. I don't want to keep everyone too long here, but let's go to aging in place for 200. So the question is, this small change can reduce falls fast, improving this throughout the home. Think about your aging loved ones. Think about what we've already talked about. And again, this small change can reduce falls fast, improving this throughout the home. And we're going to go ahead and reveal the answer to this. And this is, what is lighting? Night lights, hall. We have, even in our house, we have hall night lights. We have night lights in all the bathrooms. We usually leave, when we have company, we leave a light on over the sink so that nobody is actually in the complete dark when they're here and they're not sure where they are. My mom, when she stays with us, we have a night light in her room. So what is lighting? Again, this can, being our aging loved ones being able to see where they're going, is a huge number one easiest thing to do to be able to prevent falls. All right, let's continue. Let's go to finding senior living for 200. So this level provides help with daily activities like bathing, dressing, and medications. So now we're talking about that aging adult that may need a little bit more help. And so what type of senior living would be appropriate for this level of care? So the correct answer for this one is, what is assisted living? Now, I will tell you, assisted living doesn't mean assisted living. Assisted livings, sometimes they offer enhanced care, which means they'll do two-person transfers or they'll use a lift. Other assisted livings, people have to be completely independent. Some assisted livings will take medical assistance or a managed care organization with Medicaid. Some will be 100% private pay. There are so many different types of assisted livings. This is one of the areas that an advocate can also help you figure out what would be the best and most appropriate senior living arrangement for your aging loved one based on their needs. So let's go ahead and continue. And let's go to managing healthcare needs for aging adults for 200. And so the correct answer is, this is the best way to avoid, I forgot to ask at the doctor, bring this with you. So what is the best way to avoid? I forgot to ask at the doctor's office. So bring this with you. And oops, I need to go back and okay, sorry about that. I clicked the wrong button. So let's go ahead and reveal the correct response for this. What is using our free prep for the doctor appointment worksheet? This is another worksheet that that you have. If you feel that this might be helpful, again, if you're watching this video, drop a comment and let us know that you're interested in this. This actually is a little worksheet that you can fill out. You can help your aging loved one fill this out before they go to the doctor appointment if you can't go with them, so they don't forget to ask certain questions. They can write down answers, because oftentimes that after visit summary that they get after the doctor appointment isn't as complete and doesn't have a lot of the things in it that the doctor said. So we want to make sure if you feel that this would be helpful, we have that available for you. So let's continue. All right, we will do one more round, and maybe we'll finish it up on the next video just to get through this. But again, I don't want to keep everyone too long here, so we'll do one more. We'll do the 300. So what is a nurse advocate for 300? And the correct answer is you keep hearing different answers from different providers and you feel stuck. So what could this question be that would have this as the correct answer? So let's go ahead and we will reveal the correct response. And that is, what is when you need help coordinating care, attending doctor appointments, and getting clear communication? So again, that is another thing that we can do. That's one of the things that we do a lot of is virtually attend doctor's appointments. Our clients or their children, whoever's taking them, they go to the doctor walks in, they dial us up, put us on speakerphone, we introduce ourselves to the doctor and thank them for allowing us to participate in the appointment. And we have great conversations. We're able to ask questions. And I actually had a doctor say one time, he says, Pam, thank you so much. All of my patients need an advocate. And so that was a really nice thing to say, but we have not had any doctors that have not appreciated. They were in the beginning, oftentimes they're unsure of why we're on the call or what we're doing, but by the time we're done, they really see the value in it. So this is something that we offer as well. Okay, let's move on to we're going to skip getting your affairs in order again, and let's go to aging in place for 300. So this is a common hidden risk that can affect safety at home, not managing this well. So if you're not managing this particular thing well, this is a common hidden risk that affects safety at home. So if you want to think about that for a second, if you have an answer, just rattle them off. And we're going to go ahead and we will reveal the correct response. That is, what is medication side effects or medication confusion? A lot of times we want to contribute new symptoms or things that are not going well as to some kind of new diagnosis or disease, when sometimes we can overlook the obvious, and that is a medication side effect, especially if you had an increase in dose or you've had a new medication or changed medication. So this is often overlooked as one of the reasons why you're having some new symptoms. All right, let's go on to finding senior living for 300. The correct answer is this type of care is designed for Alzheimer's and other forms of dementia. So again, we're thinking senior living. Hopefully, most of you will get this answer correct. So let's go ahead and reveal that. So this is the level of care for seniors that are suffering from Alzheimer's or some other form of dementia. And the correct response is, what is memory care? So when you're searching for memory care, there's a lot of questions. And when we're looking for a memory care community for our clients, we have a whole list, an assessment list that we do. And not all memory cares are the same. Some are actually locked unit. Some have just a motion detector. So there's different levels of security when your aging loved one is on a memory care unit. So that's something to think about or to ask. So let's go ahead and continue. And our last question for this video, and we'll next week, stay tuned. We will finish the Jeopardy game. And so we're going to wrap up with this week's Tuesday tips for managing healthcare needs for aging adults for 300. And again, the answer is this is a red flag after a visit. You leave without understanding this. So think about that. You're with your aging loved one or you're at your own doctor appointment and you leave without understanding this. What would be the correct response? And the correct question is, can you access the doctor's note in your My Chart? And this is really important because when you get your after visit summary, when you check out from the clinic appointment, they'll say, "Oh, do you want a copy of your after visit summary?" Some people get it, some people don't. It has a kind of simple review of your visit that day. It shows all of your future appointments and it is a medication list. But what it doesn't tell you, it does not go into details on what you and the doctor talked about at the visit. That you can access through your My Chart. If you go to your past visits, you'll might see a little link that says clinical notes. That's your doctor's note talking about what happened during the appointment. This is going to give you a lot more valuable information and things that you need to take action on. So I'm going to go ahead and stop my screen here. Stop sharing my screen. And we're going to go ahead and wrap this up for this week's Tuesday tips. I hope this was kind of fun and a different way for us to be able to share information with you. So stay tuned for next Tuesday, and we'll wrap up our game of Jeopardy with what you might not know might be helpful. So take care, and we'll see you back next time.